Okay, so I told you all after I suspected my daughter had I felt my daughter had autism and was on autistic spectrum. So I wanted to get a second opinion after she had already been diagnosed with microcephaly and selective mutism by the Rainbow Babies and Children's Hospital. And my daughter had all these characteristics. So if you want to watch the first part of this, the first video, I made a video saying, did my daughter have autism? You can look at that video first. But I took my daughter to Cleveland Clinic Children's Hospital because they had this autistic department, and I wanted to get her specialized. So as you can see here, it shows at this time she was 10 years old, 10 years and 3 months. And the date of the appointments, we went back for 2 days. It was on May 29th and May 30th of 2014. And it just shows all of the services that they're providing and everything. And it says the reason for the referral was Cheers was referred to the Cleveland Clinic Center for Autism for a diagnostic evaluation with specific concerns regarding possible impairments in socialization, communication, behavior, and development. So my daughter was delayed in a lot of areas. So like I said, if you watch that first video, it will talk about all of the problems she's been having since birth. And so at this point, she was already receiving, services through the public school she was attending. They put her on an IEP and had her in a special education class where they were giving her certain services she was getting. As you can see here, it states that she was getting speech therapy and occupational therapy. And it shows that she had, I reported that she was struggling academically. My daughter was behind in a lot of areas. And, I felt that she was not on the same level with her peers and that she was very behind. And according to the ETR that she was given by her school, they had actually diagnosed her with cognitive disability. So that's, if you can see that there. And it shows here, this is the medical history where my daughter was having all these problems with insomnia. She wasn't able to go to sleep. And, I felt at the time it was due to trauma because, my children had endured and sustained sexual abuse. And I did not know what it could have been from and stemmed from. That was just my, hypothesis that, came from them having trauma. But my children were on sleep medication because they cannot sleep. And this is where she had these difficulties. So it shows here how my daughter was born, her weight, and she's always had problems. She's had problems sleeping at night, even as a baby. She had speech delay. She was only using single words around the age of 3, and she could use, phrases around 4.5. She started using sentences around the age of 6. So my daughter could not talk in cohesive sentences until around 6 years old. She was taking programs with Help Me Grow. She started at the age of 2, and they referred her to the Cuyahoga County Board of MRDD, where she would have classes. They were teaching her nonverbal skills and cues because she could not speak, and she was very frustrated because she could not verbalize herself. And it says here that she did not have a history of any broken bones, hospitalizations, or seizures, so she was not having seizures at that point. Okay, so let's look here some more. Okay, so this is the chief concern. It says concerns reported and or observed during the present evaluation. So these were concerns that were listed when I filled out my evaluation, what they have recognized as they evaluated my daughter through this assessment. So it says it was reported that Cherish presents with delays in developmental, including deficits in language. So her language and communication, she had delays and deficits. There was concerns reporting she has the ability, she didn't have ability to use full sentences. Well, she could, but often resorted back to using phrases. So that's what they're saying, that she was able to use a full sentence, but most of the time she would go back to using her phrases. She was speaking like cut off little words at a time. It wasn't a full cohesive sentence. Shows here she was doing scripting, repeating of TV lines. She had difficulty following two-step directions, difficulty responding to questions, difficulty initiating and sustaining conversations. She did not participate in conversations. She had poor understanding of personal space, tends to talk about same topics, very repetitive. And this is always my daughter, very repetitive in the subject. It was always stuck in her mind. She would constantly talk about this in repetition. She can talk on and on without realizing if the listener is interested. And then it says unusual rhythm and intonation. So that was her areas of language and communication. Then we go to socialization. And you can see here, it was reported that my daughter presents with deficits in social skills, including minimal interest in peer group, engages in primarily in parallel play, but no interactive play. So she mostly played on her own. Difficulty forming friendships, does not seem to understand social cues. Difficulty reading others' body languages and facial expressions, does not spontaneously offer comfort to others. Difficulty resolving peer conflicts, compromising with peers, and difficulty sustaining friendships, does not seem to understand or care how her behaviors impact friendship. So let's look at the behaviors. So it says, in addition, it was reported that Cherish presents with behavioral concerns, including aggression towards others. Cherish will sometimes get aggressive towards others, like if she's, agitated. Self-injuries, says Cherish will sometimes hit herself when upset. She would always slap herself or get mad. Unusual preoccupations. Cherish is highly interested in vomit. My daughter would sit and watch and try to get on YouTube and download all of these videos of vomit, and she would be looking at these videos and saving them on her playlist. And I try to get her to stop doing all that. It says here that she had an obsession and fascination with cast and broken bones, compulsion rituals, having to do the same thing. She presents with insistent or non-functional routines, difficulty with transitions. My daughter, if we were doing something, she wanted to keep doing it. If it was time to stop and go to bed or do something else, she would have a fit. Difficulties with transition. So that was what that was. Unaware of personal safety and needs, present with insistent or environmental sameness. So my daughter had to have, repetition when doing things such as sitting in the car and things like that. So just looks at the strengths and interests, that she was sweet. She liked swimming, roller skating, all these things. She was in bicycle. It just talks a little bit here about their testing, how they reached the results. And it shows here that they did this Peabody picture vocabulary test as one of the evaluations for my daughter to kind of gauge where she stood. And she had here a standard score of 75 and a percentile of 5. So her age equivalent was she tested of an age range of 6 years and 10 months. And at that time, she was 10 years and 3 months. And so then we go to the expressive vocabulary test, and she had a standard score of 70 and a percentile of 2. And the age equivalent was 5 years and 9 months. And it says here that her score in that testing indicated expressive vocabulary skills in the low range. So let's look at here, the clinical evaluation language fundamentals. This is another type of, screening and something that they go off of to use their test. One of the tests that they use here, or I guess how they evaluate, is off of the CELF-5. So it just shows my daughter's scores and everything, the pragmatics. You can see all of that. I don't want to read all of it. I don't want to take too long in this video. But it says Cherish sometimes demonstrates the following skills in the areas of rituals and conversational skills: making responsive greetings, observing turn-taking rules in the classroom or social interaction, maintaining topics using typical responses, adjusting, modifying language based on the communication situation, showing sense of humor during communication situations, joining or leaving or ongoing conversations, and using strategies for getting attention and all these other things. And this is by the time, like I said, my daughter had gotten a lot of help and she was improving greatly during this time. She was like 10 years old, but I mean, at the age level when she, was a lot younger, she really could not do any of this stuff, especially according to the milestones that they've set for her age range. But let's look here. And you can see that it's talking about she never almost demonstrates the following skills. So she was not able to demonstrate doing any of these things, or she almost never. So it was either she didn't do it at all, or was very, very seldom that she did it. And it shows here beginning and ending conversations, introducing appropriate topics of conversation, making relevant contributions to a topic during conversations or discussions, avoiding use of repetitive, redundant information, asking for or responding to requests for clarification during conversations, telling understanding jokes and stories that are related to the situation, and responding to introductions and introducing others. So she's not able to do any of those things. So Let's look here. It says that she sometimes demonstrates these things. That you can see this list: giving and asking, all that, agreeing and disagreeing, accepting, rejecting, apologizing. Now let's look here where she never does these things. Never, almost never. Giving or asking for directions, giving or asking for reasons and causes for actions, offering to help others, giving and responding to advice or suggestions, asking for clarification if she is confused or if the situation is unclear, starting or responding to verbal, nonverbal negotiations, reminding others or responding to reminders, offering and responding to expressions of affection and appreciation, knowing how someone is feeling based on nonverbal cues, reading the social situation correctly and behaving and responding to it. So it shows my daughter was not able to do those things, or very seldom did any of those things. It says she sometimes demonstrates these following skills. This is for nonverbal communication. Accurately reads and interprets facial cues and expressions, making, responding to greetings to and from others, making and responding to farewells to and from others. Use of facial cues and expressions, expresses messages by using gestures or facial expressions, adjust to body distance according to the situation. Okay, so she's able to do those things sometimes. She's capable of doing those. So here's the ones where she's never or almost never able to demonstrate doing these things. Beginning and ending conversation, accurately reads and interprets tone of voice, uses body language and gestures, uses voice intonation such as pitch, inflection, tone, or cadence, uses gestures and or facial expressions according to the situation, presents matching gestures and facial expressions and verbal messages. So that shows where she struggled in those areas. And here it just says that, according to looking at the checklist, that my daughter received a score of 4, indicating that she met age-based criteria. So this suggests that she presents with adequate communication abilities and context, and that she has difficulty initiating and sustaining social interactions with the examiner due to significantly reduced verbalizations through the evaluation. And it also said, in addition, that she demonstrated the following atypical behaviors during interaction with the examiner. She did not maintain culturally appropriate eye contact with the speaker. She did not coordinate gaze with the speaker's gaze in ongoing talk. She responded but did not extend the conversation or offer further information, and she did not pass the conversational turn. So she was not able to engage back and forth with a back and forth conversation or maintain eye contact throughout the conversation. Looks like here, these are clinical observations, areas of strength that my daughter had consistent response to her name. So if you address her by her name, she was able to respond to that. Use a single finger point to request desired items and make a choice between 2 items, following 1-step and 2-step related commands. Answered yes and no questions with a head nod or shake. Answered simple what questions such as what is it? What is it doing? Or what is your favorite? So they were asking her things like, for example, what's your favorite food or stuff like that. She demonstrated pretend and symbolic play, used a variety of gestures to communicate, initiated and responded to joint attention, used a variety of facial expressions to communicate, and responsive to the examiner's attempt to engage. So you see that here. If I'm reading a little fast, I'm trying to get through this because it's really long, and I don't want this to be like a 20 or 30-minute video. Areas of difficulty. She reduced, so this is where my daughter had trouble. So reduced use of eye contact to regulate social interactions and conversation improvement. Reduced use of words to communicate. And here it says that I reported that she had been diagnosed with selective mutism. Yes, they diagnosed her with that selective mutism. Per parent report, Cherish primarily speaks in phrases and simple sentences at home. Cherish only uses single words noted during present evaluation. So when they evaluated her, they saw that my daughter had that usage of just single words, was not able to put together, a full fluent sentence or paragraphs. She reduced spontaneous communication of wants and needs, required prompting to request items. Parent reports that Cherish does not initiate requests for help or recurrence. What was not observed, she was not observed to ask questions to gain information or for clarification when confused, so she didn't ask for help. Difficulty following directions of 2 or more steps in length with embedded language concepts, including temporal and spatial concepts, did not show objects to the examiner. Facial expressions not always directed and not observed to reciprocate questions or comments. So, I did they had me answer a questionnaire from this violent adaptive behavior scale. And I guess based off of everything I responded to, because I had to fill out basically this answer these questions. Like I said, it was a questionnaire, and these are her scores based off of my responses. Receptive, low; expressive, low; written, moderately low; communication, low; personal, low; domestic, low; community, low; daily living skills, low; interpersonal relationships, low; play and leisure, low; coping skills, low; socialization, low; gross motor, low; fine motor, moderately low; motor skills, low; adaptive behavior, low. So again, these are based off my responses, and me as the parent, I was with Cherish majority of the time, and the rest of her time she was with her family or in school and her teachers. So it states here that according to the ratings that I gave her, that my daughter had many areas of adaptive behavior which could use improvement, specifically working on personal skills such as brushing her teeth or being independently dressing herself. I used to always have to get my daughter dressed, put her shoes on and all these things. Domestic skills, being careful around hot shop objects, being able to prepare snacks and meals. I mean, my daughter at that time could do simple things like making a bowl of cereal, but like if it comes to like making a sandwich or something like that, I had to do that stuff for her. She could not count money. That was something they were really working on her with in school, learning how to count money and things like that. Having interpersonal relationships, showing happiness and concern for others. She really didn't really show emotion. I mean, she was kind of, it's like, I don't know if she recognized how others felt or not, but she didn't really show that. It shows here that, learning how to do play and leisure with others, such as sharing toys and her possessions, using please and thank you consistently, apologize for unintended mistakes. So it says, similarly, Cherish needed additional assistance in furthering her expressive and receptive language skills, as well as her written skills and fine gross motor. Overall results indicate that Cherish is functioning at a level lower than her same age peers. Thus, additional assistance in areas identified above will be helpful in furthering her skills. So here's the child behavior checklist. And according to this, her behavioral problems, as again, they had given me this report, and it shows here that the school did not return in their part, that section. So they only had mine questionnaire to go by to assess this information. And so under anxious and depressed, she was clinical; withdrawn, depressed, clinical; somatic complaints, normal; social problems, normal; thought problems, borderline; attention problems, normal. So these are based off the questions. Rule breaking behavior, clinical; aggressive behavior, normal; affective problems, normal; anxiety problems, clinical; somatic problems, normal; attention deficit hyperactivity disorder problems, normal; oppositional defiant disorder problems, normal; conduct problems, borderline. So it shows here that my daughter was self-conscious, shy. She acted young for her age. My daughter loved to play with dolls. She just did things that were, it was fine. She had a childlike mind. That was how she was always, presenting herself. So they're looking at these things. Again, let's go down here to let me see. Okay, so it says I indicated concerns regarding all these things. So you saw that. Let's look at the social responsive scale. It says a brief questionnaire, which has been normed on children ages 2.5 and up, aids in the evaluation of awareness, understanding, interpretation, communication, and motivation relating to social skills and restricted interests, all these things. So that these are their scores. I really don't know about how this, It just says, based on Cherish's mother's responses for family, has appropriate quality of life across all areas. So it says, below are the diagnostic criteria for autism spectrum disorder. And let's see. And it says deficits in social emotional reciprocity, deficits in nonverbal communicative behaviors used in social interactions, deficits in developing, maintaining, and understanding relationships, restricted, repetitive, and stereotyped patterns of behavior, interests, or activities as manifested by at least two of the following: stereotyped and repetitive motor movements or use of objects or speech, insistence or sameness or inflexible adherence to routines, highly restricted interests that are abnormal in intensity or focus, hyperactivity to sensory input. So I could say that my daughter had about at least 3 or 4 of those, if not 4. But let's look here. Symptoms present in early development period. which it was. She had these problems since she was baby, basically. Symptoms cause clinically significant impairment in social, occupational, other important areas of current functioning. So this would have to cause, problems with her, being able to, manage on a daily basis, and symptoms not better accounted for by intellectual disability or global developmental delay. So they were saying that she, has an intellectual disability. So let's look at the summary here and just go ahead and see what they're saying. So it says, making a diagnosis of an autism spectrum disorder relies on many pieces of data, including direct observation, interaction with the child, review of child's history, parental report, and teacher input. No one single factor should be used to exclusion of all else. Rather, a careful consideration of the data combined with clinical judgment is instrumental in arriving at the diagnosis. Cherish presents with a history of appropriate social, emotional reciprocity, as well as using eye contact, gestures, and pointing to supplement her speech. Although these were observed as being reduced during the present evaluation, that may be due to Cherish's anxiety, especially around unfamiliar people. Cherish has a history of difficulties with peer interactions, as the struggles with initiating and joining play, as well as maintaining interactions with others. Cherish does not exhibit repetitive motor mannerisms. She is inflexible in following routine and has highly intense interests which change frequently. Cherish also has sensory preferences and sensitivities. However, these difficulties have not been present consistently since she was very young and are not causing significant difficulties across environments, including, for instance, home and school. Thus, the data obtained for this evaluation, combined with reported history and current presentation, consistently does not support a diagnosis of autism spectrum disorder. So here's the thing, when they put all of this in here, first of all, my daughter had all of these consistent from a young age since she was born, and from birth, she was not meeting any of her milestones. This is why Help Me Grow came in the first place and referred us to the Cuyahoga County Board of MRDD. And also, it was affecting her in school. This is why they were putting her on, she was taking the OT, the occupational therapy, and all the speech therapy, and all of these things. So I'm not sure how they came to that conclusion. Second, they said that they felt that a lot of this behavior stemmed from my daughter having anxiety and not being comfortable around unfamiliar people. And so my daughter actually had these same behaviors when being around her own family and people in school who she's been in school with for years. So that's another thing. It's like, I've been reading up on a lot of the testing. They're saying to come to accurate testing, they would also monitor how these children interact with family and people who they're familiar with. And that's something they didn't do. I was sitting out in the lobby with my son the entire time, and no one ever had us come in and join and interact and evaluate my daughter based on how she interacted with us. So it's like they're saying that it was anxiety. And so that's the thing. So, but my daughter was familiar with us, but she still had those same behaviors whenever around us. So let's just continue here. And I'm going to read this last part. It says, rather, Cherish presents with difficulties with problem solving, planning, judgment, and academic learning, per her mother's report. She also has significant difficulties in adaptive behavior across all areas, as measured by parent report on the Violent Adaptive Behavior Scales. So Cherish's mother also reported that she has qualified for an individualized education plan, the IEP, under the classification of cognitive disability. And that's what the school that she was going to at the time had diagnosed her with cognitive disability. And they also did not return the input of the report. So, I don't know if it was the report that hindered this a lot, but like I said, I feel my daughter was misdiagnosed, and, she had all of those traits. It shows here that Cherish's she exhibited, oh gosh. And I can't, okay, let me see. Cherish's exhibit, I can't see that. Struggles with, symptomology consistent with, let me see. A child who struggles with both intellectual and adaptive behavior functioning. So they're saying she had anxiety, adaptive behavior functioning, all these different things. Some of the repetitive behavior and rigidity is also likely due to difficulties with understanding the environment. So that's what they said. So instead of saying she has autism, this is what they're saying. Their diagnosis for her was unspecified intellectual disability, selective mutism per history, generalized anxiety disorder, and other developmental speech and language disorder. But all of these things that they've diagnosed are a la carte, all falls under autism spectrum disorder. And I'm going to show you, because I'm going to show you here. So you see all this, you see who, this was done, these evaluations were done. And it talks about all the people who evaluated her. Leslie Markowitz, Catherine Ziegler, and Melissa Clampett. So I'm going to show you something here. So I'm going to look it up and show you, according to the Center for Disease Control. Here's autism spectrum disorder right here. It says autism spectrum disorder, ASD, is a developmental disability caused by differences in the brain. People with ASD often have problems with social communication, interaction, and restricted or repetitive behaviors or interests. People with ASD may also have different ways of learning, moving, or paying attention. It is important to note that some people without ASD might also have some of these symptoms. But for people with ASD, these characteristics can make life very challenging. So, like I said, it was hard to get my daughter throughout her day. She got a lot better. And she got a lot better because, yes, she was getting the care and the skills. And it's a good thing that I started getting her the help very early. And I'm glad that they were able to intervene and come in and help me grow. And I was also praying for my daughter's healing. So she was able to function more, but she still has handicaps to the point where, like I just recently talked about, how she's currently in foster care, and they had displaced her out of her foster parents' home for like a couple months. And during that time, my daughter had an incident that happened at school, and she's now 18 years old. And she had an incident that happened where she got sick at school, and they took her to the hospital, but they did not pick her up. They left her at the hospital. And so when the hospital discharged her, my daughter was walking around, 18 years old, around at nighttime, 10 o'clock at night, frantic and crying, could not find her way home, didn't know what to do to get back to this group home. And she had to go inside of a gas station, and they had to call someone. They had to call the police to escort her back to this group home. So things like that. My daughter still cannot manage herself on a day-to-day basis. Even though she's an adult, she still needs people to look after her and help her. And so it's like, that's autism. It states it right here. So let's just keep looking at it. Social communication and interaction skills. It says examples of these: avoids or does not keep eye contact, does not respond to name by 9 months of age. So they're saying my daughter was responding to her name, but when she wasn't doing these things by these milestones. But let me continue to read. Does not show facial expressions like happy, sad, angry, and surprised by 9 months of age. Does not play simple interactive games like pat a cake by 12 months of age. Uses few or no gestures by 12 months of age. For example, does not wave goodbye. Does not share interests with others by 15 months of age. For example, shows you an object that they like. Does not point to show you something interesting by 18 months of age. Does not notice when others are hurt or upset by 24 months of age. Does not notice other children and join them in play by 36 months of age. Does not pretend to be something else like a teacher or superhero during play by 48 months of age. Does not sing, dance, or act for you by 60 months of age. So my daughter, majority of the things on this list, she was not doing these things by these milestone ages. And some of the things, even though she was 10 years old, as you saw in that report, she was still not able to consistently do some of those things. So I don't know. Let's look at this. Restrictive or repetitive behaviors or interests. So it says people with ASD have behaviors or interests that can seem unusual. These behaviors or interests set aside ASD apart from conditions defined by problems with social communication and interaction only. So her unusual behaviors is something that would set apart what you're saying that she has anxiety or selective mutism. But let's look at these things. And here are the behaviors they're saying. Lines up toys or other objects and gets upset when order is changed. My daughter. Repeats words or phrases over and over. My daughter. They actually noted it on the evaluation. Plays with toys the same way every time. My daughter. Is focused on parts of objects. For example, wheels. Gets upset by minor changes. Again, my daughter. Has obsessive interests. My daughter. Must follow certain routines. My daughter. Flaps hands, rocks bodies, or spins self in circles. She didn't do any of that. Has unusual reactions to the way things sound, smell, taste, look, or feel. That could be her sometimes. Other characteristics. Most people with ASD have other related characteristics. These might include delayed language skills, delayed movement skills, delayed cognitive or learning skills, hyperactive, impulsive, and or inattentive behavior, epilepsy or seizure disorder, unusual eating and sleeping habits, gastrointestinal issues, for example, constipation, unusual mood or emotional reactions, anxiety, stress, or excessive worry, lack of fear or more fear than expected. All that was reported just about inside that report. And like I said, in the first video, my daughter wasn't even crawling until 14 months old, and she only crawled on one leg. So there you go. So, I am not a doctor. I don't have a license, but according to this, all the signs that my daughter had, and according to what's listed here, you make the determination, was my daughter misdiagnosed or not?